So this is our March quarterly meeting for the full Oregon Alliance to Prevent Suicide. And so far we have gone over our agenda. We talked about what the potential bylaw changes could be and our upcoming June quarterly meeting that will be hybrid in Salem, as well as our retreat taking place March 31st that will also be hybrid. RSVP links were sent out for that. And so far we have not yet met quorum to vote on the proposed bylaw changes or the minutes. We just forgot to hit record at the beginning of the meeting, but now, Craig, I will pass it over to you.
Awesome, wonderful. I think we still have a little bit of time. I think uh, if we, yeah, Jen, if we could review what the proposed bylaws changes are, just for folks to know, I think that would be helpful.
Yeah.
Just looking at that text edit, and then I don't know, folks, if you are on the listserv, Amanda sent out an email earlier this week on Tuesday. In addition to sharing information about the coming retreat, our meeting today. It also included an attachment about me needing a partner in leading the alliance. So we didn't get any nominations before today, which is totally fine. We couldn't vote on someone anyway because we don't have quorum. But if you would be excited to be either a vice chair or the chair of the alliance, happy to chat with anyone to talk about what our partnership might look like and what is kind of entailed in that. So I'll keep asking in group spaces. Yeah, for anyone who might be interested. So keep that in the back of your mind. And I think that attachment also had who was eligible. I think the primary requirement is attending a subcommittee for a year to be able to then be a vice chair or chair of the alliance. So keep that in mind in case you might be interested. Okay, cool. So we uh as we were some bylaws edits happened. Some revisions happened fall of 2024, October of 2024
Mhm.
is that when the bylaws changes occurred. And we recently realized it was brought to our attention that there are the way that we voted was different than we think is ideal. So, Jen, I don't know if you wanted to talk through the changes. Um, yeah, I'll turn it over to you if that's okay.
Yeah, and Jill, if at any point I think Kelly had to step out, she said she could come back if we meet quorum for voting. She was double booked. But Jill, if there's anything that you want to add when I go through this, please feel free to do so. So yes, as Craig said, it was brought to our attention that we may not have been voting exactly, well, we weren't voting exactly how the bylaws were requiring us to vote. So we wanted to make some of those changes, but this first change on your screen does not relate to voting. This one relates to be a completely new addition to the bylaws that would just state what public meeting law requires our meeting minutes to include, just so that way we can make sure, especially as this transition happens and there's going to be a new contracted staff to handle some of the administrative pieces for the alliance, that it can just be clear what needs to be included in meeting minutes to be able to abide by public meeting laws. And then in addition to that, we also felt that it was important to list who of staff, the contracted staff is present, and then also any outstanding tasks that need to be reported on for the next meeting. I understand that there is a typo here for there's two fours. For some reason, the changes that I made during executive did not transfer over to the document that I was screenshotting for this, but please know that typo will not be present when these are voted on. So that's the first change, is to include information about minutes that are in the public meeting laws. And then as it relates specifically to voting, there are two sections that the executive subcommittee is proposed to be updated and changed. And really it would just be around this word present. So of the members present, like right now, what Craig was saying with having 33 appointed members, 50% plus one is it's my math said 17. So that's what I was going for today, was wanting 17 members. Of those present, which means that we would need like a majority of that to be able to pass things. But by having this word present added, it would make it a little bit easier to be able to vote on things. We were also hoping to add this line around like if a voting member were to abstain from a vote, decisions will be made by the majority of the remaining voters, which means that an abstention when it makes something harder for something to pass. The reason why this was added in there is because Jill Baker, as an OHA staff and also an appointed member, has said that she was wanting to be able to abstain from things with votes because we're advising her. And so to kind of have her vote on things that would be advising her felt funky. So just wanting to be able to have that abstention, but also not make the abstention harder for things to pass. And then the third thing is the exact same thing that we just went over for the, which would impact the full alliance quarterly votes, but also with the executive subcommittee specifically. Those are the only two where we have a higher requirement for quorum to be able to be met for things to be voted on. So that's the only place where we were hoping to make those changes is in the full alliance and the executive subcommittee. And it's the same changes for both. Jill, is there, and those are the, yeah, those are the only changes. Jill, is there anything that you want to add, especially since I said things that you said before, if there's any changes that you want to make so I don't put words in your mouth?
Nope, you did great.
Okay, cool. Okay, so yeah, those are the changes. Does anybody have any questions or concerns about any of the proposed changes? Okay,
I
so
have
as
a
of,
question.
yeah,
Um, that probably I should know the answer to, but I don't right now this morning. Can we vote on these changes by email?
I thought that we weren't able to with public meeting law, but maybe I am misremembering, but I thought that public meeting law said that we were not able to vote by things via email.
We can't deliberate via email, but we can ask for a vote by email.
Oh, okay. So I guess how would that we don't have to answer this question now for logistics. We don't take up everybody's time, but that could be something that we can figure out behind the scenes and then get something out to appointed members to be able to do that vote. So that way we wouldn't have to wait until June so that executive doesn't continue to be impacted by these things. Okay, cool. So then Craig, Jill, Amanda, and I will figure out what that will look like and then get that sent out to our appointed members. And I see a hand raised, Gordon.
Yes, say we have 17 members here today, present, but Jill abstains, which means we only have 16 members, and that doesn't make our quorum. That has to recount our quorum to be sure that we've got 17 members voting today on our messages.
Yes, and so that was something until until unless these are approved, so moving forward, yes, that will have to be what will need to be checked. So that would mean that staff, whenever a vote's happening, not only do we have to check kind of like at the beginning of the meeting, like we did today, to make sure that we have quorum, but then also right before votes are taken, we have to double check that and check those things as well. So yes, that's what we're trying to figure out and hopefully address and change with these proposed bylaw changes moving forward. But as of right now, that is how we have to operate.
Thanks.
Any,
Yeah, great.
oh no, I was going to say any other questions or concerns or anything about these proposed changes? And just so folks know, while you're thinking, because I love to ask a question and then continue talking, I think it's most effective for you to be able to think about questions. The executive did kind of like talk through this as a whole too, especially around like kind of what Craig was saying with the votes that had previously happened. So executive, we've addressed that to be able to move forward. And so we're hoping that these specific changes will be able to help things function more smoothly moving forward. Gordon.
Yes, there was also another place that required, the bylaws say that a chairs of a committee have to be there, one chair has to be there
Hmm.
to make it legal. However, it doesn't say of the committee. It says a chair or vice chair, which means that literally the if we didn't have a vice chair or a chair of that committee present for that three people vote or whatever it is, that you can use any chair of any committee, not that specific, not needing somebody specifically from that committee. It's just one of those, yeah, it's just one of those things that actual wording um, is very important on how we act.
What you're referencing, I think, is, well, it is part of not what the proposed changes for today. I did pull up the other bylaws, the not the other bylaws, our bylaws, and I pulled up the subcommittees other than an executive subcommittee voting section, and I'm reading through that so we can talk about that more in executive. Right now, I do read it as saying it must three voting members of the alliance and must include a subcommittee chair or co-chair. So I think, well, I know when we wrote that, I'm assuming that you're thinking that the word A needs to be changed to be able to specify the specific subcommittee chair. When we
Correct.
wrote that, we were just thinking that was an okay specifier, but we can talk about that more in executive to be able to see if folks there want to be able to propose a change to that section as well. But for today, yeah, that one isn't on the proposed recommended changes for today's meeting.
Right. Thank you.
Craig, I'll pass it back to you.
Okay, awesome. Thank you all. Thanks, Gordon, for your questions, and yeah, just be on the lookout for an email so we can hopefully get this passed because we'll have business that needs to be voted on in June. Okay, Amanda, do you want to do an introduction of our next presentation? I hear really good things about. Um, Really excited.
I will. So I want to thank Mark Gordy, volunteer with Lines for Life, for joining us today. He is without his counterpart, Molly Murine, who has helped him do this presentation. He's going to do a kind of overview for us today, and then Mark and Molly will be doing a webinar for us later in April, which I'm really excited about. But I will, without further ado, turn it over to Mark to share all about hope. Thank you for joining us today.
Yeah, thanks for having me. Thank you, Amanda. Okay, so I am going to get set up and share my screen with everyone real quick. Let's see. Hang on. Okay, does everybody see that? All good? Got the chat
Yes.
up. Okay, cool. All right. Let me move things around for a second. Okay. Well, my name is Mark Gordy. I use he, him pronouns, and it's really an honor to share this space with you all today and talk a little bit about hope. Although I don't yet have any credentials or expertise, I'm excited to say that I will be attending a master's program in clinical mental health in the fall, so I'm really excited about that. But this presentation was really born from my experience as a crisis counselor, listening to folks who called 988, and my experience as a QPR and mental health first aid trainer with Lines for Life. So I'm really grateful to Lines for Life for that experience. But I do want to just say this is not a comprehensive or academic review of hope. It's just an exploration. So my goal is just really to spark some thought and discussion around what hope looks like for each of us as individuals and for those we serve. And then, of course, for the communities that we all are a part of. To me, hope feels extra important right now in this moment. And I guess in our suicide prevention trainings, we always talk about planting the seeds of hope. But what exactly does that mean? So there's this, as I was training to be a QPR trainer and I was learning to do these trainings, that was something I thought a lot about. And so strangely, one night I woke up in the middle of the night and I had just a ton of questions about hope, like 15 or 16 questions. And I got up and I went and I wrote them down and I went back to bed. And that's really what this presentation is born from. And I'll show you my questions towards the end of this presentation. I've only answered about half of them. So I'm still exploring and I'm excited to keep exploring about it. So what I'm going to be doing is basically taking you all down the rabbit hole of hope with me. So welcome in. Let me show you a little bit around my rabbit hole. There's a lot out there on hope, and I've really only scratched the surface. So I really want to encourage you to continue exploring as well. All right. I'm going to go really fast today because I only have about 20 minutes. So we're going to take a look at what hope is and how it works. We're going to envision hope on both an individual level and a community level. I'm going to introduce you to C.R. Snyder's hope theory. We're going to look at why hope is important. We're going to think about some circumstances that can really disrupt hope, as well as some potential strategies for staying connected to hope. And then finally, we probably won't have time for a discussion today, but we might have a few minutes for some questions at the very end. But if you attend the webinar at the end of April, I think it's April 29th, we're going to have an expanded presentation and we should have some good time for a discussion. So what is hope? To me, this word has really come to represent why we do what we do in suicide prevention, intervention, and as well as postvention work. So we are working to help connect others to hope. We're working, especially on the crisis lines, we're working to identify a spark of hope, and we're going to help try to fan that into a flame. And we're working to show someone that there are additional pathways. So in my QPR trainings, I like to use metaphor. I love metaphors. And so if we consider suicide as a journey, I like to think of someone walking down a dark hallway toward the act. And along both sides of that hallway are doorways, closed doors. We don't know how long the hallway is for that person or where they are at in their journey as they are experiencing suicidal ideation. But what we do know is that oftentimes they are so focused on their footsteps or their misery that they don't see those doors and they walk right past them. So think about this. Suddenly one of those doors opens up ahead and light streams into the hallway. And standing in the doorway is someone who cares enough to ask them if they're thinking about suicide. So it's those doors that represent hope or alternative pathways. So I'm not going to go into detail on this, but I love Chinese characters, and this is hope in Chinese. I lived in China for a couple of years and got to study a little bit of Chinese. Fascinating stuff. But a very basic definition of hope is the belief that we can get from point A to point B. So as humans, we have this unique ability to imagine outcomes, which has made us goal-oriented. So we envision a way forward, and every day, from the time that we wake up in the morning till we go to sleep at night, and for me, even sometimes in my dreams. So in other words, imagination is an instrument of hope. And it really allows us to envision a desired outcome. But also, because we are not in a world of one, we need to think about how we can get from point A to point B as a community as well. So when I gave this presentation to Lines for Lifers, someone pointed out that in their culture, hope was more about collective action. In the West, we tend to conceptualize hope on an individual level, while in the East, it is more about like the rule of community. So that's why I really love to consider hope on two different levels, for the individual and the community. So do you all remember, I'm sure, during the pandemic when there was this thing around the world where people came out and they banged pots and pans and applauded first responders and healthcare workers from their windows and balconies and front porches. So that was a display of collective hope. That was a display of collective hope in defiance of panic and fear. So hope is not built in isolation. It grows when people experience themselves as counted, as needed, and as part of a community and capable of shaping outcomes together. So I believe both of those contexts are equally important for understanding what hope is and our connection to hope. So in suicide prevention, we talk a lot about protective factors, right? So think about the power of being engaged with hope on multiple levels, not just as an individual, but in belonging to a community. So we'll talk a lot more in depth about that and what that looks like during the webinar on April 29th. But I do want to warn everyone to beware. Not all hope is good. You're probably familiar with Pandora's box. Zeus was angry at Prometheus for stealing the fire from the gods. So seeking revenge, the gods created Pandora. And in maybe the first example of reverse psychology, Pandora was given the dowry chest by the gods and told not to open. Curious about what was inside, as we all would be, of course, Pandora opened the box and out came all the evils of the world, including disease, sorrow, and vice. But then when Pandora saw what came out, she quickly shut the box, trapping the only thing left inside, which was hope. So this is where we get the phrase hope chest. So the question might be, was hope meant to be a curse, like the rest of the contents of the box, or a panacea for all those curses? So then we see that there's the phrase, a false hope. What is a false hope? A false hope is an illusion. Toxic positivity could also be considered a false hope or a bad hope. So toxic positivity is an intentional and excessive rejection of negative emotions in favor of a forced positive outlook. But good hope, on the other hand, is tied to reality. So think of the swallow. I added a traditional sailor's tattoo in the picture there. This is a shout out to YSIPP. Susie and Graham, if you're on today, shout out to you as well. This is the logo of YSIPP, Oregon Campuses United for Suicide Prevention. So the swallow represents hope, or the difference between illusion and reality when it comes to hope. How do they represent hope? Well, swallows are land birds and rarely venture too far out to sea. So on those long, torturous sea voyages of yore, spotting land in the distance could be nothing more than a trick of the mind, or an illusion, also known as a false hope. But seeing a swallow alight on a mast is concrete proof that land is near. So a swallow represents reality, represents the good kind of hope. Many of you are familiar with this book. I loved it as a kid. I have mixed feelings about it as an adult, but there is hope represented in this book. And what it shows us is that, so the little engine that could says, I think I can, I think I can. But the little engine that could does not stop with saying, I think I can. The little engine says, I think I can, and so I'm going to try. So hope is an active thing. Optimism is passive. Hope moves us to action. So that's not to say that optimism is a bad thing, because it can bolster motivation. But it can also lead to the bad kind of hope, which is not necessarily based in reality. Okay. I like this quote from Chan Hellman, who's a professor of educational psychology at the University of Oklahoma and director of the Hope Research Center. Hope is a belief that your future will be better than today, and you have the power to make it so. So this is not toxic positivity. Remember the hallway. There are other pathways available. We just need to find them. So here's hope theory. Hope theory was born out of positive psychology, which we could see as a strengths-based response to severely stigmatizing practices around mental health of the past. And what I love about positive psychology is that it's not only about addressing mental disorders with treatment, but it's also about promoting mental health and wellness for all people. So C.R. Snyder was a researcher and professor at the University of Kansas, which is my alma mater, Rock Chalk Jayhawk. And when he held his granddaughter for the first time, he decided that he wanted to give her the gift that would last a lifetime, and it occurred to him that he would like to give her hope. So Snyder's theory really began with just two simple ideas: that hope is a cognitive skill that can be learned, and that hope must be anchored to a concrete and attainable goal. And I will point out also that the subtitle of Snyder's paper on hope theory was Rainbows in Mind, and so that's why I included a rainbow on this slide. So according to Snyder's hope theory, there are three components of hope: goals, pathways, and agency, and we'll look at each of those individually. I'm not going to show the video for sake of time, but there's an interesting video that goes along with this, that if you'd like to see it, I'm happy to send you the link to that. But Brene Brown agrees with Snyder that hope is not an emotion, but it's a way of thinking or a cognitive process. So just going to take a minute to define those three components of hope theory. So according to Snyder, goals are realistic, desired outcomes that we strive to achieve. And I just want to, I'm going to connect this I'm going to be vulnerable and connect this to a story from my life. So this may be a strange thing to say, but at one point in my life, hope ended up being a bucket of paint. So many years ago, when I experienced a crisis in my life, and I experienced suicidal ideation, there was a moment in time where there was this room in my house that was this hideous color of pink. I have no problem with pink whatsoever, but this was like, imagine someone like throwing up Pepto-Bismol on the wall. Nasty stuff. And so I thought, you know what, at least the least thing I can do is I'm just going to get rid of this pink. And so I found a bucket of white paint, and I'm just like, I'm gonna get rid of this pink color, and that's something that I can do. So I started painting, and the strangest thing happened. With each new white wall that I painted, I began to feel this forward momentum. And as that pink disappeared, my personal connection to hope started to grow. So that's the beautiful thing about hope. Hope builds on hope. So even the tiniest goal can shift our momentum in the right direction. And so when setting goals, I've put some questions up here that we can ask ourselves. Why is this goal important to me? What are my values in relation to this goal? Setting goals in line with our values can be particularly powerful, especially when it comes to maintaining motivation, which we'll talk about in a minute. How does this goal connect me with the future? Again, we want to avoid that false hope. So is this goal realistic? Who can help me reach my goal? Think connection, collaboration, support, community. Pathways are those strategies or plans for achieving a goal. And there are usually many different pathways to reaching a goal. So how do I get there from here? This is like a bird's eye view, a bird's eye overview of the pathways we could take. What steps do I need to take? So this is more of a close-up, detailed plan. What happens if I encounter obstacles? So it's going to be a much stronger plan if we are able to anticipate those obstacles and build some resilience around our plans. And of course, we want to envision other potential pathways. So agency is really the energy that we have that we need to sustain towards our goals. Okay, it's the belief in our ability to take action and sustain those efforts to reach our goals. So how are we motivated all the time? Of course not. How many of us feel a sense of purpose and drive all the time? Not me. Our agency is not a constant flow. It fluctuates. And that's why we need to nurture it. So again, questions that we can ask ourselves: how do I nurture my personal agency? How have I kept myself motivated in the past? How do I manage self-doubt in order to maintain the energy needed to reach my goals? And am I taking care of myself? Am I taking care of my needs as I reach towards my goals? And then this question is really interesting to think about. Can I take joy in the process? Is there joy to be found in the process of working towards my goals? And what Snyder found is that high hope people actually enjoy the process of working towards goals as much or even more than the outcome. So hope can actually be measured, and Snyder developed the hope scale, which is a psychometric tool. And so that the hope scale measures both the pathways thinking and agency thinking. I highly encourage you all to Google the hope scale and take it and see how hopeful you are. One of the criticisms of Snyder's hope scale is that it did not always work well across cultures. And so Kraft et al. In 2019 developed the perceived hope scale for a more objective application across cultures. Studies show that greater hope is associated with improving coping, well-being, and engagement in healthy behaviors, and can protect against depression and suicidal ideation. In professional settings, hopeful employees are more productive, display greater job satisfaction, and are less likely to experience burnout. So also in my QPR sessions, I like to point out the Papageno effect. It looks like I'm running out of time already, so I won't go into detail about the Papageno effect, but it is very fascinating.
You've got plenty of time.
What's that? Got plenty of time? Okay, great. Okay, so the Papageno effect is so fascinating. It's when stories of resilience and hope presented in the media have this positive and protective effect on people experiencing suicidal ideation. So Papageno is a character in Mozart's The Magic Flute. And Papageno in The Magic Flute contemplates suicide, but is shown alternative and ultimately chooses to live. So what we see is these stories of hope and recovery have this extraordinary power to help others by dispelling stigma and myths around suicide, and by signaling that it's okay to communicate about their pain. So I'm thinking that if others can find an option, maybe I can too. So that's that discovering an alternative pathway, and that's where that hope, that spark of hope resides. So there's also something called hope fatigue. Hope fatigue happens when none of our pathways work out and we're tired of hoping, and we begin to feel like only a miracle can keep us moving forward towards our goals. Or like, that thought, man, if only I could win the lottery, all my problems would be solved, right? So what are some things that can get in the way of hope and cause hope fatigue? And this is not an exhaustive list, because the list could go on forever. But these are some things to point out that I've heard people speak of on the crisis lines as adding to their hopelessness or getting in the way of their hope, creating hope fatigue. Marginalization is a huge one. Racism is a huge one. Declining mental or physical health. Mental or physical exhaustion. recovering from trauma, chronic pain. And we're gonna touch a little bit more on chronic pain in our webinar and in what hope looks like for the disability community in particular. So I'm excited for that in April. And then grief. And one of the things that I have encountered on the crisis lines also, is that sometimes when people are experiencing grief, they feel guilty about being hopeful. They feel guilty about hope. But it's not, what I'm trying to say is that grief and hope can coexist together. It's not an either or situation. So we can be both realistic in our grief, and we can also nurture the hope of healing at the same time. So carrying both of those things at the same time is not a weakness, but it's a strength. All right, so here are some strategies for staying connected to hope. So we have goal setting or exploring new possibilities. So particularly if something is not working for us, or if we're unable to see a way forward, we may need to spend some time identifying and setting some meaningful and attainable goals, and then maybe like a reasonable time frame for reaching those goals. Multiple pathways, developing multiple plans or strategies for reaching our goals, which can then help us to be able to adapt to and overcome obstacles. Again, we want to nurture our agency. So how can we maintain our motivation? By taking care of our physical and psychological needs. So, most of you are familiar with Maslow's hierarchy of needs. We need to have a lot of those needs met before we can work towards self-actualization, before we can maintain our energy and motivation. We need to take care of ourselves physically and emotionally. So what are the barriers that we might encounter? Can we plan ahead for those? Can we map those out? Can we say, what might get in the way? And when we're working with someone who doesn't have a strong connection of hope, what are their barriers that they're experiencing? What are the barriers to the future, to a hopeful future? What are those roadblocks? So we can also revise and adapt. That means continuously assessing our motivation and revising our plans as needed, right? Focusing on the positive, that means like breaking it down into smaller goals, tracking our progress, and really celebrating those successes along the way. So again, I'm not talking about toxic positivity, but about finding ways to avoid negative self-talk and maintaining our motivation by giving ourselves grace. And by, if there's a period of time where our motivation is low, we can give ourselves some grace on that. And we can encourage ourselves that tomorrow's a new day, and we can try tomorrow. And then learning from the past. What worked in the past? What were past successes and what have we learned from them? What are mistakes that we've made? And really maintain an open, future-oriented mindset. Number 8 is a huge one. Connecting with others. As we talked about earlier, hope is social. We find it in connection. We find it in community. We find it in mutual encouragement. So seeking out support, seeking out collaboration with others, seeking out communities where we feel welcome, welcoming others into our communities as well. Visualizing success, so reflecting on what a positive outcome will look and feel like while staying grounded in reality. And then sharing stories. Stories are powerful. And we just need to be willing to be vulnerable and willing to truly listen. So sharing and seeking out those stories of hope and resilience, as in the Papageno effect, can help with motivation. So this is just something to think about. How can we foster hope? in others? What can we do on an individual and community level to foster hope in the people around us? Okay, and usually this would be like a discussion topic, but just something to think about. I'm really fascinated by narrative repair, which is a therapeutic and philosophical approach to mending damaged identities by replacing negative life stories with more empowering counter stories. So it involves sort of rewriting personal, social, or historical narratives to restore that agency and sense of self-worth and community membership. So how do we shift the focus from what is wrong to what is possible? So here are some final thoughts on hope. Hope is a way of thinking, which means it can be taught. Hope is adaptable, which can help us maintain resilience, particularly if we're able to identify multiple pathways. Hope builds on hope. Hope is social. It happens in our relationships with others and is strengthened by our connectedness. Hope is particularly powerful when it aligns with our personal identities and values. And hope impacts us both on an individual level and a community level. So here's some recommended reading. Most of the presentation I got from C.R. Snyder's The Psychology of Hope. But I also really, the Midnight Library is a fiction, a book of fiction, and I loved it. It was given to me by a friend, and it works through the premise that asks us to explore our regrets in relation to the future that we desire for ourselves. So it helps us to just reframe and re-examine what hope looks like for us. Well, here's my initial questions. And the ones that are crossed out are the ones that I've answered in this presentation, but I'm super interested in all kinds of different aspects of hope, and I'm just going to keep adding to this presentation as I learn more. I would love to hear any questions that you all have about hope as well, so I can add them to this list. So if you end up thinking deeper about it and you have a question that you'd like to add to this list, email me, please. I would love it. Yeah. Thank you very much for your time. I really enjoyed showing you all around my rabbit hole of hope. Here, I have some references as well, if anybody is interested in that.
Thank you, Mark. One of the things I do as a staff is I facilitate the walk group, which is our white accountability learning community. And I actually found an article around suicide prevention and narrative repair. So yeah, that's something I'm looking into, because one of the other hats I wear is I do run my own practice. But I appreciate this talk so much. I am so looking forward to our webinar in April on the 29th. Thank you so much for being here. We've got time for questions. If anybody has any questions for Mark, I want to let you know I appreciate you. So I got introduced to this in the QPR Be Seen, Be Brave Learning Collaborative. I just want to share that, again, like I said, I have my own business. Your presentation actually sparked some things and some movement for me in my business. And I'm also using it to inform my talk for tomorrow's Out of the Darkness Campus Walk that we're doing. So your talk has been super impactful for me, both personally and professionally. And I'm just super, super grateful. Hope has been a word that's been around in my life forever because it was my grandma's middle name, right? So, and it's a big word in when we're, thinking about suicide prevention and the work we do. So I just really appreciate these broader kind of perspectives, as well as kind of some deep dives into parts of it that I had never either known about or hadn't considered before, like the Pandora's box thing, right? All these things. So I'm just super, super grateful. But yes, we have time if anybody has any questions for Mark.
Thank you, Amanda. That means a lot to me. That makes my day. Any thoughts at all about what hope looks like for you or in the work that you do?
we've got a quiet or shy group this morning. And we're all distracted by Ruthie's cuteness.
I could answer that question if that's okay.
Yeah.
I get to work with a lot of veterans and a lot of veterans family, and hope in veterans comes from each other. So your question on there was, is hope contagious? I think was one of the things that was on there.
Yeah.
And in the population that I get to work with, it definitely is contagious. And conversely, the same thing that spreads it in a positive manner takes it away in a negative manner, right? They lose their hope as a group very easily together. And that tends to trickle down to their children, which is also people that I get to focus on. And so I think it's a really great thing to talk about what builds hope and additionally what dashes hope, because it's just as easily taken as it is given and built. So thank you for a wonderful talk. That was awesome.
Thank you for sharing that, Kimberly. Yeah, so I actually got to do this presentation for a post-vention group as well. And so, talking about contagion, and how can we use hope in a community to counteract contagion, is fascinating. I'm interested in that. So thank you for sharing that.
So my coalition was one of the grant recipients from 2 years ago. And one of our grant projects was to put on what we called Hope Fests. And Hope was an acronym, which I cannot remember right now. I think it was healing, outreach, prevention, and education. So yeah, I just love how hope continues to pop up in my world in these different ways. And yeah, again, thank you so much for being here. Cannot wait for the deeper dive on April 29th. Yeah. And thank you again, Mark.
Thank you so much for having me. Appreciate it.
I'm so sorry, Amanda.
Yeah.
Craig, this is Noel. Sorry to interrupt. I wanted to say, Mark, thank you for the presentation. I loved the integration of stories and literature through the presentation. That was really inspiring for me. I feel like art is designed to motivate and represent and encourage humanity. So thank you. I wanted to name, you're probably familiar with the Emily Dickinson poem, Hope is a Thing with Feathers, but that is my absolute favorite piece of literature related to hope. So thank you. And also, I'm sorry, Craig, Amanda, I'm certain this information has already been shared, so I apologize. And like when I was teaching, I told kids, ask again, because someone else has probably got the same question. Is there a link or registration for the longer presentation that you can provide, please? And I'm sorry, I'm certain you've already shared it. So thank you for your flexibility.
It actually has not been shared yet because we are still nailing down a time. I
Right.
don't believe, Mark, that we've got that nailed down, and we've been working on getting, of course, quarterly out there in retreat. But as soon as that is out, we will make sure it gets sent out to everybody.
You probably already said that as well. Thank you for saying it again.
I hadn't, so thank you for asking.
Yeah, no, that was great. No, we had not talked about those things, nor had that question been asked. So we appreciate you asking it. Mark, thank you so much. Yeah, really excited for the webinar and for your co-presenter to join as well. Hope is a thing that's really important to all of us right now. There's a lot going on. And so having hope is really essential and important. So thank you so much for that conversation. Amanda, I think you're next as well. So we'll keep it with you.
Yes. So, again, speaking about communities and hope in communities, as we are moving into this transition, in contractor, Jen and I have been thinking a lot about how we as staff can support you. And also, Jill has very graciously been wanting to get any feedback on what can be added to the RFP for the new contractor. So we decided we would kill two birds with one stone, so to speak, and capture all of that information in a survey. So we're going to give you folks RFP, request for proposals. Thank you. And so there is a jot form link in the chat. We're going to give you all some time to do that. And then once you've got that done, we're also going to take a break. So Jen, what time do we want folks to come back? Was that 11:15?
That's what it says on the
Okay.
schedule on our agenda for today.
Awesome.
Sorry. Yes,
So,
Nathan got a hold of a pen, a sharp one, so I had to snag that. But yes, 11:15.
yes. So please take some time, do the survey, and then take a break, and we will see you back at 11:15. And if you aren't able to complete the survey today, as long as you get me it by Monday at noon, that would be great so I can get the RFP information to Jill. Thank you, everybody.
Jen, if you're near your computer and can hear, do you want to stop the recording for the break? Right, hi everyone. Hopefully you got an opportunity to fill out the form. Thank you for your contributions. That's going to be really helpful to current staff, OHA and future staff, as well as Alliance leaders for what y'all need as we move forward. Um, Hopefully y'all had a good break as well. I got a little snack myself, so hopefully you got a chance to stand up, get a snack, have some water, take care of anything you needed to. I think the next thing that we have planned on our agenda is Amanda's going to go ahead and review for us what each subcommittee is working on in through the YSIPP. Amanda, take it away.
Thank you, Craig. So yes, I using the Smartsheet tool, which I'm so appreciative of. I went through and pulled out all of the Alliance YSIPP initiatives and broke them down via subcommittees or general categories. And so this is kind of my color coding system. So if the initiative number is highlighted in green, it belongs to healthy and empowered individuals, and so on and so forth. And then if there is a red, yellow, green, or purple dot, that indicates what kind of standing they are in as an initiative. And so Jill dropped in the Smart Sheet link, and Jen dropped in some links for the document that I created. So you can use those to kind of follow along, because I will not be reading out every initiative. I'll just be kind of doing an overview of those. And then we're going to take some time to go into breakout rooms by subcommittee and kind of do some unpacking and discussing. For those of you that aren't in a subcommittee particularly, you can join whatever is of interest to you. And so I will dive in. So first up are some general kind of alliance initiatives. So just kind of some overviews of, kind of what is expected between OHA and the alliance. So obviously we are the primary advisory group for Oregon's youth suicide prevention field, right? It talks about our staffing, our efforts to center disparities, and how we're going to continue to focus on and improve accountability to our youth population, especially those 18 to 24. And then we also have some around the kind of communities of practice and how those things move forward, right? Our meetings and those kinds of things, and how updates happen, how we will develop our recommendations for our policies and priorities to OHA by October 1st. And then, as you can see, this one was new in 2025. So it does get, we do get to recommend things kind of yearly, and those things do get added. That is evidence of such. So again, just kind of some general alliance initiatives. My computer likes to change how it wants me to keep forwarding these forward as slides, so I apologize. So then I broke down into what ones applied for kind of just general youth driven or lived experience initiatives. So again, when we are thinking about moving forward as the alliance, if you aren't in a subcommittee per se, but you're dedicated and committed to this work, these are some of those initiatives that you can look back and tie into. I think the only red initiative we had out of all of them was this one about youth representation on the alliance. And so that is something that we all can kind of be working on, is some of that recruitment to get youth voices here and more present in the alliance. And then again, there's a couple initiatives for coalitions, which I know there's a lot of us here that are coalition leads or members as well. And then I also included the data and evaluation subcommittee on here, because right now that one is on pause, but there still are initiatives that apply to that subcommittee. And then if we start to get into the other subcommittees, the equity subcommittee has several initiatives. And again, so if the front color coding on the initiative number tells what part of the YSIPP it falls under the 4 categories, these dots are indicating kind of where it stands in progress, whether it is in good standing, but there's more work to be done, which is what the yellow indicates, The kind of purplish blue is that it's a new initiative, right? So again, not going to read these out to you. The links are in the chat if you need to pull it up and like to follow along on your own. And the links are also there so that when we do go into the breakouts, folks can utilize those documents as well for the discussion. So I'm just going to give a little bit of time on each slide for folks to kind of look, take note. And again, Jill will be talking about the bookshelf, as she calls it. So if you're like, hey, wait a minute, I thought we also kind of take note of that. And those are things that we can look at and see, make sure they're on the bookshelf, and discuss maybe if those were ones that instead were out of the scope of OHA as well. And knowing my neurodivergent self, I'm going to avoid the chat. But Jen, if there is anything that comes up in the chat that I need to pause, please let me know.
Will do.
Thank you. So again, Equity Subcommittee continues. I think this is one of our committees that has kind of the most initiatives, this and workforce. We're definitely heavier. Some of these are, I don't think it's on this slide. Some of them have kind of two coalitions or two, excuse me, subcommittees that will kind of be accountable. Not sure if it was on the previous. You know that there was one where, yes, so this one, 144, excuse me, is both the executive subcommittee and the equity subcommittee. So those two work together in that initiative. And then for the executive committee, if they are tabbed over like this, that means obviously they are something that falls under the one that is above them. So you can kind of follow along that way. So this is kind of the full YSIPP, not just the kind of the quick, more brief outlines. This is kind of getting into the nitty-gritty initiatives. So again, you can see how some of this work is being done probably in multiple spaces, right? Around kind of the centering disparities. That's probably something that's happening in more than one space than the executive, but it's under the executive committee in the YSIPP. So again, that is a committee that has several initiatives that it falls under. A lot of them are new. Again, some of them have to do with kind of looking at who we're serving and making sure we're, you know, taking in more of a cultural or wider lens. Some of them are around, you know, reporting both out and getting reports back from other entities like OHA. Lethal Means has a couple of initiatives. So again, looking at revising work plans, right, kind of paying attention to the ever-changing landscapes, which obviously we just came out of a short session. And so there's been some impacts there that we were talking about in the meeting this week. And then the new initiative there. Some of these are a little more wordy, right? But again, I don't want to spend the time reading them out. And then our schools subcommittee. Again, we've got, you know, things around our Addis Act, our student success plans, those things. I know that in the April schools subcommittee, we will be having folks report on the student health survey. So again, that's where we kind of get these presentations coming in. So just making sure we're getting informed by any other bodies doing the work so that we can move our work forward and have our work be informed. So that's coming up in April. And then actually, I'm going to go back because this last one with the toolkit. So the toolkit is up and live. There's feedback that can always kind of come in, but this is, if you haven't taken a look at the toolkit yet, it's pretty impressive. There are tons and tons of live links for articles, resources, and more. It is quite the beast, but it's obviously been a labor of love by the folks that were on that work group and that created it. So it is something worth taking a look at, I will say. And then our transitions of care subcommittee. Again, you'll see that some of our subcommittees are kind of concentrated in different areas of the YSIPP. And again, we do have a lot of newer initiatives. And part of our reason, again, for sharing these today and going over these is, again, just that recentering, right? As we're trying to move forward, even through a transition, we want to kind of come back to why we're all here. What is the work that we have to do, which is these initiatives. And so I, kind of without prompting, created this document and did this work because as a neurodivergent, while I love the smart sheet, I needed something else to kind of look at. And I wanted to be able to support the subcommittees with moving this work forward. So I figured the best way to do that is, hey, let's make it really clear and easy as to what is under each subcommittee and what is the alliances to do so that we have that quick reference. If you are somebody that needs things in a different format, I also have it in a chart format. Yes, I am that neurodivergent nerd that likes to create things because, you know, our brains all learn in different ways. If you'd like to see it created in a different way, I also like to create things. So just let me know. I'm open to suggestions. And then we've got our workforce subcommittee. So again, you'll see how other entities like OHA are involved. And we've got the small steps project listed in here, right? So again, how we are working with other entities like our community advocates. You know, U of O is something we've worked with in the past with our suicide prevention lab. Yes, Jill, you had your hand up.
We go back a slide. I just want to give an example of, because there have been that's cute. A couple of questions about like, well, that's not what we submitted. Like here, the one on the bottom there is one example of one that got adjusted from its journey from the workforce subcommittee to land in the final YSIPP. I think the original thing that the workforce subcommittee submitted said that basically said like the UO lab would do a landscape scan. And because that has implications for contract and bandwidth and those types of things, we reworded it to say that to go through the process, which the subcommittees can request technical assistance in evaluation pieces, but there's a process to do that. So it goes from subcommittee to the executive committee. Then we bring it to a contract monitor meeting to see if there's bandwidth and where does it fit with all the other things. And so that's an example of one that changed over the lifespan to make sure it was included, but included in a way that we could meet the system need also.
Thank you for explaining that. I appreciate that. So again, just some more for workforce subcommittee. And I think this is all of them. So again, what we were going to do is we were going to put some folks or put up breakout rooms, excuse me, that Jen has been busy creating, which I appreciate. And you can join the appropriate subcommittees for which you are under. Again, if you are not particularly in a subcommittee yet, but there's an area of interest, you know, please feel free to join wherever. Jen, I don't know, did you also create one, like, because there are those general initiatives, kind of the bigger overview. Did you create a breakout room for those as well? Or do people, if they want to talk about those, maybe just stay in this room?
No, we can add that as a room, like the general.
Okay. I just wanted to I recognize I don't think our schools chairs are here or our transitions of care chairs are here. So I didn't know
I can jump into schools since that is one of my subcommittees.
Cool. Okay, great.
Thank you, Craig, for pointing that out.
Mm-hmm. And I didn't know if there was going to be an executive committee space.
There is one.
Okay. So we'll need someone for transitions of care.
If Megan is still here, Megan, if you feel comfortable, it's okay if not. If you feel comfortable, would you okay sitting in the transitions of care space? Not to be the expert in the room, but just like I feel like you're just somebody who's present in those spaces.
Sure. Yeah, I'm happy to do that.
Thank you. Angela, I think it's up to you. Like, that's a good question. That's why I was kind of on the fence about having an exec space or not, to be able to see, like, since the chairs have a spot on an attend executive. So I guess like that would be like up to you with like wherever you'd like to go to talk through things. And I think like our hope and our goal for these subcommittee spaces after kind of going through a big look at the YSIPP initiatives for the 2026 calendar year is for folks to be able to, I know that we already meet on a monthly basis for most of us, and um, being able to just kind of like talk through after seeing them and seeing what some of the other subcommittees have been assigned to see like if there's any ideas for directions for moving forward and kind of like next steps or maybe some like areas for, I don't know, just like where folks want to go and do things. So it's up to you, Angela, what you want to do. And I want to acknowledge that Karen had a question in the chat, but I'm wondering, I know that you put a response, Jill, but I wonder too if maybe digging into that could also be helpful during your portion too, after the breakout rooms, if that feels like a good timing for that. Okay, cool. So Angela, I'm sorry that I did not give you a direct answer. You can decide where you want to go, workforce or exec, but I just opened them up. They should be self-select to be able to pick where you want to go. I have to stay here because I think there has to be somebody in the main space just in case there's any concern. So I'll be here in case people have questions, but feel free to go where you want. You can even bounce around if needed. Oh, and we'll be here for about, I think we gave ourselves 15 minutes for this, so about 15 minutes.
Sorry, Amanda or Jen, can you repeat the prompt, like what we're reading through the initiatives and seeing if there's any
Discussion. Yeah.
Yeah.
I think because we're not being assigned, we have to open up. There's like 3 dots you have to open up and say join a breakout room.
Correct.
Oh, thank you, Jill. And if you tell me where you want to go, I can assign you to. So if you're having any issues, just tell me where you want me to put you and I'll put you where you want to go.
Hey, Jen, I'm not really sure where I should go because I'm not a part of any of the
Yeah, no.
subcommittees. Should
Okay.
I just hop into the general initiatives?
Yeah, you can go there, or if there's like a specific subcommittee that you're interested in, you can also go there. But yeah, it's wherever either you have an interest in or you can go to general.
Okay, I'll just hop over to the general one. Thank you.
Okay. Yeah.
I'm gonna go pop into schools.
Okay. Does anybody need help being put into a room?
No, I was just being slow to see because I could go to a couple different ones. So I was just looking to see which had the
Least amount.
I think I'm going to go to equity because I'm schools and equity were the two. Don't usually go to transitions of care workforce.
Okay.
Jen, could you throw me in data and evaluation? For some reason, I'm not.
I did not make one for that one since they haven't been meeting. So that's
well,
why
there
you
go.
don't see it.
That's why I don't see that. Okay, sorry, I wasn't.
No, you're okay, Roger.
Shanda, any preference just to spread our might?
Well, there's no there. So Megan is in transitions of care. Workforce is just Linda right now. I wonder about just going to the Taylor's in that one. Do you go to the lethal means work group, Roger? You don't, do you?
No, I don't.
I think you can go wherever you want. I think I'm gonna go to equity because there's only 3 there.
Yeah.
And there's no OHA in that room.
Okay.
But you could go to general, maybe.
Yeah.
Or workforce. Craig is in workforce now, so up to you.
Okay. Yeah, cool. Just wanted to check. All right.
and I had to step away. Um, Maybe the schools group or group would be good.
Where would you like to go, Gordon?
Um, Probably workforce.
Okay, perfect.
Thanks.
Yeah. You want to have this? There's nothing in there. It's empty. It's a cup. Nope. Okay. Are yummy? And then Mama. Okay. Okay. That's Mama's pen. Hi. Nope. That's Mama's. It's gonna stay there. Hi. Hi. Water. Hi. Hi.
Too soon. We weren't
Hi,
ready.
everyone. I hope that was a good conversation in all the various spaces. Though I think Megan was solo in the transitions of care. But perhaps lots of time for personal reflection. Um, I think the thank you for that heart reaction, Megan. I think that what we talked about in executive, part of what was like the focus of our conversation is I posed the question of like, um, what does progress look like when these are initiatives that like last for 5 years? How do we track progress? Also, like what should progress look like and how much, how should we be making forward movement? One of the things that came up was uh, possibly for each initiative, like having a plan, kind of developing a strategy for making progress on those to then demonstrate that progress, which feels like it takes time. I did acknowledge in our space that we're still in somewhat of a moment of transition. I think the retreat is going to be really good. I think when we have new staffers come July, that'll be more set, things will be more settled. And so hopefully, and this is something we can talk about in executive among the subcommittee chairs, but just ensuring everyone feels like uh, they kind of know what we're working on, what our strategy is, or at least the steps to develop that strategy to make progress over the 5 year period on the various initiatives. Um, any report out or thoughts from any of the subcommittee spaces?
Well, first, I'll just say I'll try not to take that whole new staff in July thing as a slight there, Craig. Just kidding.
Also, I didn't say things would be better. I said they would be like settled, right? Like they,
I'll go lick
I tried to be intentional with
my
my
wounds
words
later.
there,
It's
and
all good.
apparently they were not intentional enough.
No, we were having a really great conversation. It was great because there was some new voices in the room. Um, as well as those of us that have been digging into the work in the school subcommittee. So my brain is churning on how do we continue some of this, right? Where we can maybe get some of those new voices in and have some of more of these discussions because it looks like in the chat, everybody's like, we didn't have enough time. We didn't have enough time. And I just want to reflect back that shows, right, that this work is why we're here and it's what we're doing. And hopefully that'll center us back into moving forward. But yeah, great discussion happening in the schools group. Talking about burnout and capacity and like how do we resource our folks so that we can keep those safety nets in place.
Yeah, a lot has transpired since we drafted our initiatives as well. The world is in a place. So thanks for sharing that. There's no pressure to, but any report out or thoughts from any of the other subcommittees?
Well, Gordon, keep me honest here if I miss anything from the workforce subcommittee. We talked about in general, there was a high interest in the 18 to 24-year-olds and the new sort of more explicit focus on that population just generally in the YSIPP. And we talked about how within the workforce committee to look to the YSIPP initiatives and find concrete and specific ways for implementation, not what we haven't done or can't do, but where we can move forward in a more productive kind of framework for the work that's going to be done. And more specifically, looked at the small steps, opportunity to reach employers, and to maybe add to that initiative some language that's sensitive to what young adults might be experiencing in that age group from 18 to 24 and how employers can support and motivate them. We also talked about leveraging some new members into the group that might have experience more from the perspective of workplace and workforce, not to put aside the healthcare stuff. That focus would remain strong, but to be able to look broadly at other workforce components as well, and being able to generate enthusiasm about reaching the 18 to 24-year-olds with the positive, more concrete, we can do this, or, as opposed to we haven't done or we don't, that kind of stuff. Gordon, did I leave anything out?
Well, and working in conjunction with the school committee.
Oh, yes. Thank you for that. We talked about how a part of that would be a good collaboration across the schools committee around preparing young adults, or in what ways can the school committee help generate ideas around supporting that transition period of post-high school. Thank you, Gordon. I forgot that piece.
Got it.
Jen, go ahead.
I was just gonna, from an outsider perspective, like seeing the chat and hearing the conversation, it seems like, I know that September, or the fall time, is which will be when the new contractor is here, is the time when kind of like those subcommittee slate is like solidified for like the upcoming year, right? And just like hearing all these conversations, like people wanting more time and more of that conversation, like it seems like that will be a good thing for the new contractors. Like they're going to be really stepping into a time of like, again, with that transition, but just making sure that you all have those times and spaces to connect, even in like our quarterlies, kind of like outside of the monthly meetings, to be able to talk through things. And I think that this quarterly space too, I know that there's been a lot of ask for subcommittees to see what other subcommittees are doing. And so being able to kind of like have these like regular reminders and check-ins, and having like folks from other subcommittees have a chance to kind of like talk with each other and like learn from each other and see how you all can collaborate. It seems like that's going to be something that will be important for the new contractor to be able to do and kind of like add time in. And then also when thinking about like where you all are wanting to go and what you're wanting to do, like when that conversation around like what slate of subcommittees like do you want to have for the upcoming calendar year, and what do you want that work to look like. So it just, I don't know, it's nice to see that you all are, I think I knew this, but it's just like to get that reminder of like you all enjoy each other, like being in each other's space and like in this work and sharing this time, and really that regular ask to have more of this like team building connection time is something that's really important. So like how that can continue with the new contractor, I think is going to be really important to talk through.
Yeah, thanks, Jen. I think as you're saying, just highlighting, it's important for us to know what each other is working on, especially if there are opportunities for collaboration or connection among the various subcommittees. Especially, I think, with these overarching things around, transition age youth, 18 to 24, priority populations, those that were already priorities for us, youth of color. Um, uh, 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 and then adding additional youth as well. So more for us to think about across the board. Marianne, no pressure, but anything from the equity group that you want to share, you don't have to.
We briefly just went over the Growth Zone invitation, which is not a YSIPP initiative, but I love what Tim pointed out. It enables us to sort of feel comfy, cozy in our work towards initiatives. And was just going over it for folks in the space that hadn't been to some of the equity subcommittee meetings, just to give a brief overview. And obviously I'll give a deeper overview at the retreat, I believe. But we were just then starting to dig into our initiatives. And similar to what you had mentioned earlier, there's this idea of like, what's our tracking going to look like? How can we measure this? How can we be really intentional to show what our progress is looking like and make it really like a visibly tangible thing that we can sort of be looking at. And then Shanda was about to share some juicy bits and then it got cut off. But I just, this was super duper helpful. I think it felt like energizing to see it this way and to see it laid out this way. So I'm feeling excited for the next equity subcommittee meetings. Please join us. Please join us. We're doing such exciting things.
Awesome. Thanks, Marianne. Shanda, feel free to put the hot goss in the chat. Everyone can know. It's great. Tell us all. Okay, well, in an effort to stay on time, just thank you all so much for the conversation. I think I added to our retreat agenda some more intentional time around the YSIPP initiatives and ensuring that we feel good as a collective about what we're doing and how we're moving forward. We are going to hand it over to Jill now to talk about those initiatives that are on the bookshelf, and she can tell you all about that.
Starting with, I think I'm the only one who likes the term bookshelf for this list, that most other humans would call it a parking lot. But Shanda loves it. And I haven't gotten any angst about the bookshelf. I just like people, it could be a bike rack, it could be a storage unit. It is the list of things that folks either said they wanted to be included as an initiative in the YSIPP, and the Alliance subcommittees are one source of that, one of the major sources of that. But then also in the YSIPP 2630 development, we did a whole bunch of stuff to ask around. We had a survey that went out, and this is all in 2024. So if you don't remember, that's why, because time. So folks filled out surveys, which the University of Oregon helped me qualitatively code into categories. We did a group activity at the Oregon Suicide Prevention Conference about what do we want to start, stop, and continue? What do we want the field to look like in 5 years? We did focus groups with the child psychiatrists. And coded some feedback from the Black Youth Suicide Prevention Coalition, their applications for youth. There were about 50 of those, and 2 of the questions on the application included things about what do they wish adults would know about Black youth mental health or suicide, and then also what helps you with your thoughts of suicide or with making your mental health better. And so those 2 pieces were also coded. Vivian Koomson helped with that at the UO lab. So in the spirit of we can do anything, but we can't do everything, I asked folks to pick their own YSIPP initiatives. So the YSIPP initiatives that you just all looked at, that's what came from those subcommittees to me. Gave an example of one that got tweaked around that in the workforce subcommittee. Some of the recommendations that came from you all were not for OHA. They were like, the Veterans Affairs should do this, or there should be a change in law for DOJ here, or ODE should do this. And so if the recommendation wasn't housed with OHA, I emailed those recommendations on behalf of the Alliance to a human in those areas. And so those recommendations are not on this bookshelf list. They were given to the holder of the decision there. And then the rest are on this list. Shanda asked me, is this list public? Can people see it? And I said, no, that seems like a really good idea. I should make this list public. Then Shanda asked, this is a story about Shanda. Then Shanda asked if there was a way for people to be able to submit bookshelf ideas so that when you're in your work in your committees, even if it's like, oh, that would be such a good idea, we should consider that when we do our annual review of what's the next right step, should we start, stop, and continue, that list is already sitting there and not having to be regenerated. And so I will think about how to do that best, but purpose to get the bookshelf ideas into a publicly lookable place so that it's not hidden in my computer, which is where it's sitting right now. There are 49 things on this list, as well as 12 legislative concepts or 12 policy kind of ideas or recommendations that would require that maybe some work could be done outside of an actual legislative concept, but that they were put through in the policy recommendations. And nearly all of these came from the Alliance. There might be a couple of examples that came from like the post, I think this one came from the post-vention response leads meeting that gather the county level post-vention response leaders. And oh, look at that. I should probably take her name off there. And one from Caroline Suter. So, okay. So the categories, oh, sorry, Caroline. It's a good one. It's a good idea for the record. This is the way that my brain kind of categorized them, things that were kind of overall in the system. These bookshelf ideas, again, are because we either didn't have funding for them, and things like, there's probably one, yeah, like this one, for example. A fully funded YSIPP would mean that every county and tribe has staff for suicide prevention, funded staff for coordinating suicide prevention activities. That is a piece that that when we put forward funding asks for when lawmakers ask what does a fully funded YSIPP look like, that's what that one is on there. And I will happily grab it off the bookshelf or park bench or bike rack and plug it into the YSIPP at any old day of the week when somebody tells me that we have money to do that. So that's also an example of sometimes the bookshelf is the aspirational pieces. I tried to think about putting into the YSIPP 2630 the things that we are going to do. We think that we can do them. We think that we have what we need to move them forward. And that's squishy. You'll see a flag in the YSIPP 2630 tracker, that smart sheet. You'll see a flag for funding needed here. So it means that I think we can get started and move in the direction versus this one, which is like, I'm not going to put that in there in this moment of time because it's aspirational to provide all counties and tribes with a coordinator and have an operating budget. Other categories, here, let's go to training. That one might be interesting. So one of the other feedback sessions in prep for the 2630 was at the 5-year anniversary of the Big River. All of the coordinators met in Salem and kind of did that start, stop, and continue brainstorm. So many of these came from that day and then from the conference, because training is a thing that's easy for people to conceptualize ideas around. And so here are some of the ideas, and I'll stop talking so you can read. Maybe I'll zoom in a little bit too. Here are some of the ideas that came that didn't get included as an initiative. Not that they're not good ideas, because we can do anything, but we can't do everything. They just didn't rise to the top of the to-do list when we were thinking about what can we realistically get done in the next 5 years. And every single year when we update what projects we're working on, we have this list. And so if we get to We get to the end of the year and we're like, you know what, we really need a concerted effort to make sure people know what the Big River is and that brand name. Then we can add that through. My guess is when I was pulling and making lists, that the brand recognition and being able to market and those types of things had a cost associated with it. And at that point, I was out of my money chart. So I was moving things over that couldn't be done with integrity, that needed funds, which is a guess. That sounds like something I would do. I don't actually remember that. Addis Act, lethal means. Zero suicide. This one has an explanation of why it didn't get included, so you can see those pieces. Because Megan Crane's a hero of the world. Treatment pieces. Data pieces. Good ideas, but high effort. And or like that's another, another category of what didn't get included is like if there were so many, the complex team that would have to come together to do it. That not that it's not a good idea or that we will never do it, but that in this moment of time when we're looking at the next 5 years, it doesn't get to float to the top. And then postvention has its own category as well. That is the list of bookshelf ideas. I will PDF that and have Jen and Amanda send it out in the meeting minute notes so that it's not super secret. I did want to just address Karen's question about how do the alliances initiatives support or relate to or support the overall goals of the YSIPP. So this far left column with the 3 numbered categories are the goals of the YSIPP. So for example, our goal would be to have regional suicide prevention coalitions that are informed and resourced to address their local needs and priorities in a culturally infused way. That is a goal in the YSIPP. Here are the strategies that we're going to do to get to that goals, that we want to make sure that those coalitions are receiving information, education, and updates. And the 2 projects, the 2 tangible things that we will do to support that strategy along the way to the goal is that it's in the Alliance contract. And so it's in Amanda's list also in that first section of contract deliverables to host learning opportunities for the field, which like the recent AI webinar and the upcoming HOPE webinar, those are examples of that in action. And then to make sure that the field is also receiving resources, educational opportunities, policy updates via the listserv. And so we have that quantified in so that we can say, is this on track or is this not on track? To the point of Marianne, who said, how are we going to measure these things over time? Some of them are quantifiable. Did we get listserv messages out twice a month? Yes or no? On track. That's easy. Many of the initiatives that the Alliance wrote in are things that are a bit squishier. Like, well, I guess a work plan is a tangible thing. I'm going to try to find one that's okay. How will we know that we have strengthened recruitment and retention of culturally diverse, geographically representative, and underrepresented members in the Alliance leadership and membership? When is that good enough? When have we done that thing? That's a little bit harder to quantify and decide on what where the progress has been good enough. So the two ways that we're tracking that right now on the smart sheet are, one is the current status, where are we at in this snapshot of time. So all of the initiatives have a label about either it is, and I should have logged into my view so I could change it. Well, the colors that Amanda put on that list. So in good standing, not in good standing, more work to do, brand new, those things. So that is whether or not we are as far along as we thought we were going to be. So like, this work is never done, but it's in good standing, where we've made progress in a way that feels like it is good progress. So subjective, but a way to quantify. And so then in each annual report, I make percentages of all of these. So I say in the 2025 report, which is going to come out in the next month or so, it'll say 86% of the initiatives in the YSIPP 21-25 were in good standing, or whatever. That's I made that stat up, but it bunches them together in that category. And then the second way we're measuring is the status area. So these categories are not yet started, really early planning, in progress, or achieved. And so by bundling those also and saying like, okay, we've got, and so at the beginning of the 26-30, we'll have a whole bunch of not started because they're brand new initiatives. And hopefully by the end of the 5 years of the plan, we'll have seen movement from to more or most of the YSIPP initiatives being achieved. So it's imperfect. It's not exact science. It's kind of like social worker science, but it's a way to tell the story and to look. And the who's deciding those categories at the moment is the person who is designated as the lead human for that work. So they get a ping from the smart sheet asking them to update those columns and the progress note column, so that when I'm going through to do the annual report, then I'm just able to like pull percentages from the individual categories. So I'm going to pause. What is happening in your brains? Are they just like, it's Friday afternoon now? Any questions or ways that I can help support the answer to where did our ideas that didn't make it into the YSIPP go? Or how are we measuring the progress of the YSIPP? Or what was the tea that Shanda never spilled? I don't know the answer to the last one. Cannot tell you.
I think I first personally find myself in this place of like 5 years is a long time. And so like it just started on January 1st. So like it's only March now, but many things in life move quicker than we think they will. And so I really appreciate the focused time that we've had today to like think about this and make sure that we're on the right track and it's not where, we get to a point where like, oh no, we feel behind, wanting to be really like proactive and ahead of the game. So I just appreciate, the space to think about these things.
Marianne, I wonder if Mateo has any thoughts on this issue. Look at those cheeks.
I know those cheeks bring out my cuteness aggression. Like I just want to just squeeze them.
Hey, buddy.
If we could get Mateo in the same room with my service dog Rufus, it would be cuteness overload.
Cuteness overload. Mateo just had a birthday. That one's 1 whole years old now. Soon to have his own apartment, I'm sure. Just kidding. I will not rush that for you, Marianne. I take it back. I apologize. Okay, I think that's what I had.
All right, thank you so much, Jill. Thank you, everyone, for spending that time in subcommittees thinking about the YSIP and the conversations that you had. There's so much work to do, and I am so thankful for the time that we all have to give. And of course, we could give so much more time because there's so much work to do. But the work that we are able to do and the timing that we're able to do it is really wonderful. So I think we have 10 more minutes scheduled. We don't need to use that whole 10 minutes, but just wanted to wrap up with any announcements that we might have. Just as a reminder, Amanda just threw into the chat, I believe it was Amanda, that there are a couple things that we're hopeful that you can fill out if you didn't get a chance to finish the survey from earlier about current and contractor needs. Please fill that out by Monday at noon. So those things can be shared, I think with OHA, but in general. And then we have our retreat coming up on March 31st. So please RSVP if you haven't. I did hear that we had quite a jump in RSVPs from before today. So maybe you RSVP'd in this meeting, and that's wonderful. But so excited to see hopefully many of you on the 31st, some of you in person if you're available to get down to Salem, up to Salem, over to Salem that day. Our June quarterly, June 12th, will be a hybrid meeting. So if you're able to make it to Salem for that meeting, we will have some in-person space. But again, of course, we'll have our remote options as well for folks who won't be able to make it to Salem that day. Jill, I don't know if you wanted to share any update on the RFP. That might be something that you could share.
I was just thinking about that. So the competitive bid for the Alliance staffing contract comes out through a request for proposals. That has seen some movement in the OHA cog of getting things from an idea to out the door. And so that's one reason why I'm asking for your feedback so quickly is because it's been assigned at its second to last stop. And so it is possible that that RFP would come out in the next couple of weeks. If it does come out in the next couple of weeks, I will extend the time. 30 days is the least amount of time. You have to have at least 30 days. You have to post something for 30 days. But because spring break fills in there, if it comes out before that, I'll extend it to an extra week or two to be able to allow people to rest and rejuvenate with their families rather than worrying about filling out an RFP. And I have asked the question about whether or not the Alliance can designate a couple of people to serve on the evaluation committee for that RFP. I've not received an answer yet, but if the answer, I have been told in the past both yes and no to that question. And so if the answer is yes, the Alliance can I can have outside evaluators to help score the Alliance application. Then I will, it'll be at the end of that, either 1 month or 5 week period. And so we're still about 6 weeks away from needing that. But if that's something that you feel interested in, let Jen or Amanda know. And I think the executive is going to talk through it at their next meeting to make a decision so that we're ready if they say yes to be able to know who the people would be. Jen has a cow on her lap, or a small dinosaur.
Yes, he's very upset that this is a long meeting, so he started to paw me, so it's just easier to deal with this, the 50-pound lapdog, than the pawing. So here we are.
Mountain goat.
Yes.
That's funny.
Thank you, Jill, for the update on the RFP. I do as Jill said, we might have the option to have someone participate in the scoring for new contractors, and it would be a quick and perhaps large time commitment. So we would love for appointed members, if any of you have interest and capacity, even if you're like, possibly I could do that, will you let Probably Jill and me and maybe Jen and Amanda or one of the four of us know, and we will get that information to the rest of us. But definitely helpful to have those folks on deck. Our hope, the hope, is to have someone as soon as possible, someone being new contractor, and perhaps there would be some overlap between the two. So it'll be as quick a process as we can make it.
And I just want to say it's okay if there's not somebody who's interested and able to give that level of time commitment, that the process can move forward without, like, in case there's like shame or guilt percolating about not having time. It is I'm trying to extend an invitation, not make another requirement.
Thanks, Jill. Any other announcements or updates for the entire group before we close out? As an extrovert, I'm just trying to count to 13. Okay. Thank you all so much. I appreciate you. Thank you for being here today. Thank you for the work you do in subcommittees. Thank you for the work you do in general. Appreciate you all so much. We will see you again in this space in June. Yeah, if you need anything, please be in touch. But thank you all so much and happy weekend.
I should have brought cash. I'm sorry, I was done.
Bye, y'all.
Shanta.